Right. So the leg region, is the region that is between the knee joint and the ankle joint in that region. Right. And we have two bones in the leg. We have on the medial side the tibia, which is larger. Then on the lateral side, we have the fibula. Right. So you find that some of the muscles that we're going to discuss in the leg, we're going to call them fibularis something, meaning they're coming from the fibula. Some of them we're going to call them tibialis something, meaning they're coming from the tibia. Right. So the first port of call would be to show you guys that we have the tibia and the fibula. And just like in the upper limb where we had a radius and an ulna, joined by an interosseous membrane in between. In this case, I also have an interosseous membrane here that joins the tibia to the fibula. Right. So I want to focus more on the muscles that we have in the leg. But before we do that, the other time we say that in the thigh, there are three compartments. Right. And what divides these regions into compartments? We have intermuscular septum. So the layers that I told you guys from the outside, we say there is skin. If you remove skin, you meet superficial fascia. If you remove superficial fascia, you get deep fascia. After the deep fascia, you get the muscles. After the muscles, you go to the bone. So the deep fascia creates the septa. Septa meaning septum, singular, plural. Septa that divide your region into compartments. So if you want to divide something into two compartments, for example, in the arm, when you did the upper limb, you only have an anterior compartment and a posterior compartment. For that, you need two septa. But when you want to divide something into three, you obviously need more than two septa. You will now need three. Because if this is your leg, I'm going to draw this. If this is your leg, and maybe the bones are there at the center there. If I have one septa there and another septa there, I've divided this into two. If I want to further divide into three, I need another septa like that. So I end up with compartment number one, compartment number two, compartment number three. Right. Having said that, the leg has three compartments. There's an anterior compartment, there's a posterior compartment, then there's a lateral compartment. Unlike in the thigh, where there was anterior, posterior, and medial, the difference is that the leg has a lateral compartment. Other books, they say four compartments in the leg. But the four comes from the fact that the one that we have said posterior compartment can be further divided into two other compartments that I'll show you shortly. A superficial compartment and a deep compartment, right? But for the purposes of learning for this session, let's use three. Right. I will further subdivide the posterior into two rather, but don't worry about that for now. So to make life easy for you guys, I'll generalize every compartment. Right. So we will generalize the nerve supply, the blood, the muscle function for every compartment, because these are things that are going to be similar. All the muscles in the anterior compartment have one innervation. All the muscles in the lateral compartment have one innervation. All the muscles in the posterior compartment have one innervation. So there's something unique about the leg or the lower limb. Every muscle below the knee joint, meaning in the leg and in the foot, is innervated by one large nerve. and it so happens to be the largest nerve in the body. And that nerve is called the sciatic nerve. I'll show you the sciatic nerve when we do the popliteal fossa. Right. So this sciatic nerve, what it does in the popliteal fossa, right? Or maybe I'll just go back to popliteal fossa for now. What it does in the popliteal fossa, the sciatic nerve would divide into two. And the two nerves that it divides into are, number one, the common peroneal nerve. Right. So yeah, so there is a common peroneal nerve, this one, the smaller one, and there's a tibial nerve. This is the same sciatic nerve that I said innervates muscles of the posterior thigh. And remember, when we're doing posterior thigh, I say that all the muscles in the posterior thigh are innervated by the tibial part of the sciatic nerve. So tibial nerve, this tibial part of the sciatic nerve innervates all the muscles in the posterior thigh except one. The one exception was this muscle here, the biceps femoris, right? And only its short head. So biceps femoris has a long head and a short head. The short head of the biceps femoris is the only muscular part from the posterior thigh that gets its innervation from the common peroneal part. All the other muscles in the posterior thigh are innervated by the sciatic nerve. So one would ask, why am I saying that this nerve divides in the popliteal fossa, yet I'm saying in the posterior thigh, higher up there, it's already divided. So sciatic nerve is a two-in-one nerve. So the two nerves, they travel like they're separate nerves that are bundled up in one sheath. So sciatic nerve is two nerves that are bundled up in the same sheath. And they only get to separate behind the knee joint in this space that we call the popliteal fossa. Right. What are the boundaries of this popliteal fossa? It looks like a diamond. Then you can see here, the green there. Right. So popliteal fossa looks like a diamond. Right. That's the easiest way to remember. So if you have a diamond, that means you have four boundaries. There's upper medial, upper lateral, lower medial, lower lateral to create your diamond. Right. So the lower boundaries are easy because these are the muscles we are going to talk about today in the posterior leg. So we have a muscle called the gastrocnemius. Those who know Shona, we call it tapu, muscles of the calf. The gastrocnemius here has a lateral head and a medial head. And so the lower lateral boundary of the popliteal fossa, you just say lateral head of gastrocnemius. The lower medial, you just say medial head of gastrocnemius. Then the upper boundaries, I just need to think about muscles in the posterior thigh. And our posterior thigh, if you remember quite well, there were only four muscles: semitendinosus, semimembranosus, the hamstring part of adductor magnus, and the biceps femoris. So I always ask people this, or maybe make people remember. Of these four muscles, three of them insert on the medial side. So semimembranosus, semitendinosus, and the adductor, they're all on the medial side. Biceps femoris, this one, is the only one on the lateral side. Meaning to say that the upper lateral, here, there is biceps femoris, the one that goes to insert on the lateral side. All the other muscles like here, semitendinosus, semimembranosus, cut high above there, they're the upper medial boundary. Right. So I'm just using knowledge from the previous region to apply to know what the boundaries are. Right? But point for you, why I came back here, the contents of this popliteal fossa, content-wise, there is a nerve, which is, okay, there are two nerves which are coming from the sciatic nerve. The two nerves are the common peroneal and the tibial nerve. Then there's an artery and there's a vein, the popliteal artery and the popliteal vein. So I would love to do maybe a tutorial on the blood vessels of the lower limb to tell you how we come up with the popliteal artery, because this artery that we're calling popliteal artery is the same artery which we were calling femoral artery when we're doing the anterior thigh. So it's femoral artery in the femoral triangle, then it enters your adductor canal, it still is femoral artery, then it enters the popliteal fossa, where it changes name now. It's now popliteal artery. Same concept where, if you remember your upper limb, you say that subclavian artery, outer border of first rib, becomes axillary artery. That axillary artery will change name at the lower border of teres major, becomes brachial. So this popliteal artery is just the femoral artery that has changed name. And that popliteal artery, for the purposes of the leg that we are doing, it is going to divide into two. It divides into the same way brachial artery divides into two, radial and ulnar. Popliteal would divide into anterior tibial and posterior tibial. So when you're using common sense, remember I said the leg has three compartments: anterior, posterior, lateral. And I'm saying the artery divides into anterior tibial, posterior tibial. I'm going too fast, please stop me. So anterior tibial will give blood supply to the anterior compartment of the leg. Posterior tibial will give blood supply to the posterior compartment of the leg. Right. Then what's left? The lateral compartment. So common sense will tell me that if I have two branches, the one that is more likely to innervate, not to innervate, it's a blood vessel, to give blood supply to the other compartment has to be the larger one. And the larger one in this case is the posterior tibial artery. So popliteal artery divides into a larger posterior tibial artery and a smaller anterior tibial artery. Anterior tibial artery will supply the anterior compartment of the leg. Posterior tibial artery will supply the posterior compartment of the leg plus the lateral. And remember I said the lateral side, in terms of the bones, there is the fibula. So other books, they use the word peroneal. So these words are interchangeable. I'm mentioning this because you may come across a muscle called peroneus longus. Maybe when we're talking right now, then when you read your books, it's written fibularis longus. The words mean the same thing. So posterior tibial artery will give you an artery called the peroneal artery. So the word peroneal already tells you that it's for the lateral compartment of the leg. So when I talked about sciatic nerve, I said it gives us this nerve labeled here, tibial nerve. Then it also gives us the other nerve here that is labeled it's labeled common fibular nerve. So I think you can see that this atlas uses the word fibula, but let's use the word peroneal. It makes it easy to talk. So common peroneal nerve and tibial nerve, those are the nerves that are coming from the sciatic nerve. Tibial nerve innervates the muscles of the posterior leg, full stop. So tibial nerve is muscles of posterior leg. The one that is left, which is the common peroneal, Common peroneal will innervate muscles in the anterior and muscles in the lateral compartment of the leg. But how do I grasp it? Has anyone ever felt a cord when they were trying to roll the lateral aspect of their knee? Or has anyone ever felt the ulnar nerve here? I think you guys were doing upper limb recently. Remember, ulnar nerve passes behind the medial epicondyle here. If you roll here, you can actually feel for the ulnar nerve. Right. The same concept, if you roll on the lateral aspect of the knee, you can feel for this common peroneal nerve as it winds around the fibula. Right. So common peroneal nerve, what it does, it goes to the lateral compartment of the leg into a specific muscle that I'll show you when I do the leg. That is called peroneus longus. So once it enters the peroneus longus, the common peroneal nerve will then divide into two. It divides into a deep peroneal nerve and a superficial peroneal nerve. Friends and family, when we say deep and superficial, I'm not speaking in relation to the leg. I will tell you when we get to the ankle why one is deep, one is superficial. It has nothing to do with the leg. The deep peroneal innervates muscles in the anterior leg. The superficial peroneal innervates muscles in the lateral leg. So for now, I want you to generalize it. Posterior leg, tibial nerve. Anterior leg, deep peroneal nerve. Right. Lateral leg, superficial peroneal nerve. Right. Okay. Then when we're doing leg, we move away from the words flexion and extension. Right. The words still apply, but we use specific terminologies. So remember yesterday when we're doing thigh, I say that the upper limb, we usually say that muscles on the anterior aspect, they flex. Those on the posterior, they extend. That was the rule for the upper limb. Eh? For example, triceps is posterior, it's an extensor of the elbow. Biceps is anterior, it's a flexor of the elbow. That's an example. For the leg, remember I said it's the opposite. For the lower limb, rather, in general. Muscles in front are extensors, muscles behind are flexors. Right. So I'll use my hand. Confirm you guys can see my hand. Let's assume that's a foot. Right. So when you do this to your, let's say this is a foot that is standing on the ground. When you do this to the foot, right? Common sense should tell you that what pulled this foot up are tendons on the anterior leg. Right? Because this part of the foot is the one that is on top, that is anterior. So what pulled this foot up are tendons on the anterior leg. And this part of the foot, we call it the dorsum. This is the plantar aspect. Unlike the hand where this is palm, this is dorsal. For foot, it's plantar. So there are two words. There's what we call dorsiflexion. Then there's what we call plantar flexion. So dorsiflexion is this. Plantar flexion is this. I think you can see my hand. So this dorsiflexion, muscles on the anterior leg are what's causing dorsiflexion. Muscles on the posterior leg are what causes plantar flexion. But remember I said muscles on the anterior, they're the extensors, meaning dorsiflexion is extension. Plantar flexion is what we call true flexion. I'm trying to move away from those traditional definitions where we say flexion is decrease in an angle, extension is increase in an angle. It may not make sense for every joint, right? So muscles in the anterior leg, they do what we call dorsiflexion. Muscles in the posterior leg, they do plantar flexion. So far, so good, eh? Anterior leg, dorsiflex. Posterior leg, plantar flex. Having said that, I haven't talked about lateral. Right? So lateral, I don't want to talk about it on its own. So in as much as anterior is dorsiflex, posterior is plantar flex, there's an additional movement that I'll show you when we do the foot. The movement occurs at 3 small joints in the foot. These movements, we call them evasion. Let me write these words down. Maybe it's your first time. There's evasion. There's evasion. Then there's invasion. So the general rule is if I have a foot, okay, let's say this is my leg. I can divide this leg into 2 equal halves. Don't mind the way I've bisected it. The muscles on the lateral side, whether you are in the anterior leg or posterior leg, any muscle on the lateral side will do the function of evasion. Then any muscle on the medial side, whether you are in the anterior leg or posterior leg, will do a function of invasion. So what's left now is to put the muscles in your head. So if you know that tibialis, it means it's on the medial side. You have its function already. It's going to invert. And if it's on the anterior leg, it's going to dorsiflex. So these are concepts that you need to stick first before you go to the individual muscles. Otherwise, you spend the whole day cramming a book. Right? So what's evasion? What's invasion? If your foot is on the ground like this, your 2 feet, if you can see my hands, when your 2 feet look at each other like this, if the plantar aspects look at each other like this is invasion. If they look away like this, that's evasion. Right? So enough of my weird talk. Let's do the muscles. So the atlas starts with posterior, so we'll start with posterior so that I don't need to be going back and forth. Ideally, I would have loved to start with anterior, but it's fine. It's always good to start with things from the front, not the back. This is a bit weird. No, let's start from the front because there are ways that I want you to remember for attachments of muscles. Okay. Also, these are not knowing, like, which reference book do you guys use? Which book are you using for your lower limb? So that I know the appropriate words to use. Do you guys have a reference book that you're using so that I can?
Yeah, the prescribed books.
Which book?
Snell's Clinical Anatomy.
Snell. It's fine. It's fine. It's fine. If you're
It's
using Snell, it's fine. Okay.
Yeah.
So
and yeah, that's what's written.
Right. So forget that this page is written anterior leg superficial muscles. That's another way I would have loved to teach, but forget about that. We can say superficial, we can go to the deep, whatever, but no, let's forget it. Let's just say anterior leg. So already I've told you that muscles in the anterior leg, they are dorsiflexors. Number two, I've told you that muscles in the anterior leg, blood supply is anterior tibial artery. Right. So number three, something that is unique about all these muscles in the anterior leg, they all arise, or maybe not arise, they all originate from the fibula, except one. So all muscles on the anterior leg originate from the fibula, except one. So what's left for me is to remember the exception. And the exception is quite clear. It is called tibialis anterior. The origin for the tibialis anterior is the tibia. Remember I said the leg has two bones, a larger tibia on the medial and a smaller fibula on the lateral. Now I'm saying all muscles on the anterior leg, they originate from the fibula, and the tibia is the only tibialis anterior rather is the only exception, which originates from the tibia and the interosseous membrane that lies between the tibia and the fibula. So you've already covered origin for all the muscles. There are 4 muscles there. So let's just name them for completeness sake. I would love to do a separate video on the ankle region. The ankle region needs us to do the entire leg. Then we start describing how things pass through the ankle, the same way we did the wrist. So there's a muscle called tibialis anterior. So let's number them. There is tibialis anterior. And remember I said that the anterior leg is extensors. So there's a muscle called extensor hallucis. The hallux is the big toe. Just like how the pollex is the big thumb, the hallux is the big toe. There's a muscle called extensor digitorum. So the way we do lower limb, the way the lower limb is arranged, it is just an upper limb that is inverted in the opposite direction with the same type of muscles. They may not be word to word or muscle to muscle, but they're almost similar. Remember, there were digitorums. Posterior forearm, there was an extensor digitorum. It was only one of it. The anterior one, there was a flexor digitorum superficialis and a profunda. So when I go to the posterior leg, I will see something like that. Right. There's tibialis anterior. There's extensor hallucis longus. There is extensor digitorum longus. Then the fourth muscle, we call it peroneus tertius. Right. Peroneus, remember I said it means fibularis. It's on the lateral side. So of all these 4 muscles, the peroneus is the most lateral. So it goes back to the words. Right. So tibialis anterior, extensor hallucis, extensor digitorum, and the peroneus tertius. The last 3 muscles on the list originate from the fibula. Then the top one, the tibialis anterior, originates from the tibia and the interosseous membrane. Right. So there's a compartment that I'm very lazy about, which is the lateral compartment. So I'll combine the lateral compartment with these muscles so that it may I make life easy for you. So on the other side, I'll put number 1, number 2. So lateral compartment is 2 muscles. So let's use the word peroneus, not fibularis. I know it's written fibularis here. There is a peroneus longus. If you ever call a muscle longus, that means there's a shorter version of it, which is a brevis. So the second muscle in the lateral compartment is the peroneus brevis. Peroneus, remember I said it means fibula. So these are muscles also originating from the fibula, just like the muscles in the anterior compartment. There's a reason why I've brought these muscles together here. The insertion for every muscle in the lateral compartment will resemble an insertion of a muscle in the anterior leg. For example, peroneus tertius and peroneus brevis, they have the same insertion. So we are now making life easy for each other now. Peroneus tertius, it inserts into the base of the fifth metatarsal. That is the base of the fifth metatarsal of the small toe. Peroneus brevis is the same insertion. Tibialis anterior is the same insertion as peroneus longus. So if you are smart enough to realize, before I go to the picture, tibialis anterior is on the medial side. Peroneus longus is on the lateral. Because remember I said peroneus means lateral, tibialis means medial, tibia. So how do these muscles end up with one insertion, yet one is on the lateral, one is on the medial? So when we do the foot, the sole of the foot, I'm going to see the tendon of this muscle, the peroneus longus, crossing the sole of the foot to come to the medial side. So after everything has been completed, you should have like a puzzle that's complete. Things should make sense. So tibialis anterior and peroneus longus, they insert into what we call the medial cuneiform. It's a bone on the foot, as well as the first metatarsal. Yeah, there are bones on the foot that I'll show you. Right. So let me show you the muscles first. So this is a picture that you're seeing here. This is tibialis anterior. This is extensor digitorum longus. The hallux is a bit deeper, so you can see it here. Then this muscle here is fibularis longus or peroneus longus. This is lateral compartment. It's not part of anterior compartment. So, okay, we have girls in the meeting. But if you ask boys, most boys, when they play rugby or soccer, they wear shin pads. Why? Do you guys know why people wear shin pads for sport? I think this picture explains or gives us the answer. Why would you wear a shin pad? What do you want to protect? Do you want to protect the shin?
I think you would have to, yeah, protecting the shin itself because it's a shin pad.
So okay. So why would you be worried about protecting it from this picture that you're seeing here? Maybe this picture has removed some other things from this picture that you're looking at here. The shin is on the tibia, by the way. And when you look at the tibia, I'll share a video that I've done on the tibia, an actual tibia dissection. The tibia, the anterior border, the medial border, and the surface in between, which we call the medial surface, they are subcutaneous. You can actually feel them from the outside. So why you can feel those things is because look at the muscles here. I just told you that all the muscles in the anterior leg, except one, they come from the fibula, meaning the tibia is left exposed. So that exposure, if you're having a bone that is bare, which is closer to the skin, contact sport can actually lead to fractures. That's why it's advisable to wear shin pads, right? So when you go and interact with your friends from other faculties and what you can, educate them, right? So this is the muscle that I said will be a bit deeper. For us to see extensor hallucis, we need to remove the other muscles. right? But let's just consider it an anterior compartment. Let's not try to say superficial deep for this one because it will confuse you. If you're using Snow as your reference book, it doesn't use that. Right? This is tibialis anterior. This is extensor digitorum. Right? Then I said if you lift the digitorum, you see the hallucis. Right? Then the fibularis tertius originates from the fibula lower down here. We called it peroneus tertius. And look at where it's going to insert. Remember I said it inserts into the base of the fifth metatarsal. This picture is showing us that. Right. Tibialis anterior, look at it here. Remember I said it goes to the base of the first metatarsal here, as well as the medial cuneiform, which is this bone here. Right. The hallucis in the digitorum, I would describe them in the foot. It makes sense when you do the foot because they'll be having the brevis there. Right. Arteries and nerves, I've already told you. The innervation for anterior leg, I said deep peroneal nerve. The innervation for posterior, not posterior yet, but for lateral leg, we said superficial peroneal nerve. And the word superficial and deep, I said we'll only use them. Okay. The reason why we use superficial and deep is relating to the ankle, not how they are working in the leg. So it has nothing to do with the leg. Blood supply. I think you can see here. This is the anterior tibial artery. Remember, I said popliteal artery divides into a smaller anterior tibial artery and a larger posterior tibial artery. Right. Okay. So far, so good. Okay. Do you guys watch soccer? If you do, I think you remember there's a team called PSG. Or if you've had any male friends who watch soccer, they must have told you about PSG. Okay. So the muscles in the posterior leg, remember I said you divide them into superficial and deep. Those that are superficial, we remember them with the mnemonic PSG. That's why I was asking about PSG. So I've been fortunate enough to teach for, I think, 3 or 4 years now. So when you're teaching different people, they tell you different mnemonics and different words. So you always find better ways to make people remember through teaching other people. Right. So there are 3 muscles, right, that are superficial. But for this video, let's say 4. There's another muscle that I want to show you, because that muscle is neither talked about in the thigh nor in the leg. It's in between, but we'll talk about it with the leg. So P there is the plantaris, right? So remember upper limb. There was a muscle called palmaris longus. And that palmaris longus, you would say that it's absent in 10% of the people. Absence of a palmaris longus was not associated with any clinical abnormality. And the medical use for that palmaris longus is when you get a tendon rupture anywhere else in the body, you can go in and harvest the tendon, because even if you remove it, it's insignificant. It's the same with the plantaris. So usually when I teach lower limb, I would have done the whole body from the neck going down. So we would have done thorax, abdomen, pelvis. So I usually say we have 4 P muscles that are like that. And the 4 P muscles which can be present or absent. One is in the upper limb, which is palmaris longus. One is in the leg, which is plantaris, which I'll show you shortly on the picture. One is on the anterior abdominal wall within the rectus sheath, your six-pack muscle, which is called pyramidalis. Then the other one is on the posterior abdominal wall. We call it psoas minor. Those two I'll show you when we do abdomen. Right. So we have plantaris. The S is the soleus. Then the G is the gastrocnemius, this muscle here, where I'm putting an X. This is the gastrocnemius. Right. So gastrocnemius has a lateral head and a medial head. This is the muscle that I was saying it forms the lower boundaries of the popliteal fossa. So gastrocnemius, lateral head, medial head. When I was doing my anatomy item degree, I had a colleague who did a research on those two heads. They're different. One head is larger than the other, and one head contains what we call a sesamoid bone. Does anyone of you know what a sesamoid bone is? You must have read about sesamoid bones in the upper limb. There are quite a lot. In the lower limb, there are quite a lot. And quite interestingly, the largest sesamoid bone is the patella, which is on the knee joint. Right. It's a bone within a tendon. Right. Okay. So PSG. So this is the gastrocnemius. This gastrocnemius is fused with the S. Let me see if I can get a better picture. Okay, here. So this is your soleus here. So this is simply because the gastrocnemius has been removed, but the two are tightly joined together. Right. So gastrocnemius and the soleus, they have the same tendon, which is here. This tendon is called the tendocalcaneus. Others prefer to say the calcaneal tendon. It's them. Others prefer to say the Achilles tendon. Do you guys know why it's called an Achilles tendon? Or
I have no idea personally.
But have you ever read about what do you call this? The history of Achilles, whoever from it must be Greek, right? Greek mythology, something like that.
No, Greek.
Anyway, it's an interesting story. You can look it up. It's an interesting story. How maybe it was his weakest part and the likes. So this soleus and the gastrocnemius, they have the same tendon here, which inserts on a bone called the calcaneum. The calcaneum is the bone that forms the prominence of the U. It's the largest bone, so of the small tarsal bones on the foot. These tarsal bones should remind you of the carpal bones, which you used to say she likes to play, try to catch it. The scaphoid, the lunate, the carpal bones here. There were 8. For the foot, we have 7 tarsal bones, of which the largest, which forms the prominence of the U, it's what I'm calling the calcaneum here. So calcaneum, that's where this Achilles tendon inserts. Right. The other muscle, the P here, look at it. It's the plantaris. Just like the palmaris longus, short belly, very long tendon, so it can be mistaken for a nerve. That tendon also inserts onto the calcaneum, but it inserts separately from the Achilles tendon. So already I've told you that PSG, all those three muscles inset onto the calcaneum. The gastrocnemius and the soleus have the same insertion, which is the tendocalcaneus / Achilles tendon. Plantaris has its own insertion. Oh, by the way, I forgot to tell you, for the two heads of the gastrocnemius, the larger one is the medial head. The lateral head is the smaller one. When you want to compare these two heads, right? This picture may not give you that kind of a impression. So medial head is larger, lateral head is smaller, right? Then you can see that they're originating lateral head from the lateral, medial head from the medial, right? Condyles of the femur. So medial head from the medial condyle of the femur, lateral head from the lateral condyle of the femur. Right. Okay. And innervation for these muscles, I've already told you, it's the tibial nerve. Tibial nerve is the innervation for muscles of the posterior leg. Right. This is soleus. Soleus, when you look at the posterior aspect of the tibia, I'll share the video that I've done with an actual tibia. You see a soleal line. So soleus originates from the soleal line. Quite simple, eh? But above that soleal line, there's a muscle that sits directly above it. Now that's the muscle that I said I'll just include it in this talk. It's called popliteus here. Yeah. Go ahead.
Anasu. Oh, okay. I'm saying, where's the soleus line? Where is it?
The soleal line. Okay. Okay, let me look for a tibia. It's fine. Okay. Or maybe I actually don't need a tibia. I just need okay. Do you see this this tibia? Can you see this narrow strip red line here labeled soleus? That's where the soleal line will be. It goes oblique like this. So can you see that above that soleal line, there's a blue item there? That's where the popliteus inserts. Right.
Oh,
then below that soleal line, so attaching to the soleal line and below now, there's the soleus muscle. Right. So the only reason why I chose to show you the popliteus muscle is the language will become like this. At the lower border of the popliteus muscle, the popliteal artery will divide into two: anterior tibial and posterior tibial. I know earlier on I just said popliteal artery divides into two. No one asked where, but that popliteal artery divides into two at the lower border of the popliteus muscle, divides into anterior tibial, which I said is the smaller, which should go to the anterior leg. This is posterior. So can you see that hole there, the opening in the interosseous membrane? That's the hole through which the anterior tibia will go to the front. I think I can show you on a picture. Yeah. So can you see anterior tibia is now coming to the front here through that hole there. Do you appreciate the anatomy there? It's coming from the back.
Yes.
It's coming from the back. Right. Okay. So that's your popliteus muscle here. Then personally, okay, maybe this is on video, but I prefer teaching things that are relevant to people. If maybe you guys were a physio class, you then start to talk about locking and unlocking the knee joint. Does anyone know what that is, for interest sake?
Personally, I don't.
Anyway, the popliteus muscle unlocks the knee joint. So, have you ever wondered why you can stand, but your knee joint will not rotate? It has to be locked. Otherwise, there was going to be a lot of rotation there. You wouldn't stand properly, right? So, there's a muscle that locks it. Most people prefer to talk about what unlocks, but they don't talk about what locks. What locks is the quadriceps femoris, the one that we mentioned yesterday on the anterior thigh. Then what unlocks is the popliteus, because for you to raise that leg from the ground, for you to stand, you have locked it. When you now want to raise that leg, you need to unlock it first. And what unlocks it is this muscle, the popliteus. That's another significance. But I've been around for a while. I haven't seen how knowledge of that will help me. Right. Then the other muscles in the posterior leg that are deeper. Remember on the anterior leg there was a tibialis anterior. So obviously there should be a tibialis posterior. Right. Then on the anterior leg there was an extensor digitorum longus. So there should be a flexor digitorum longus. There was an extensor hallucis longus. So on the posterior leg, there should be a flexor hallucis longus. So superficial group at 3, PSG. Deep group 3. Tibialis posterior, flexor digitorum longus, flexor hallucis longus. So now, how do I remember these muscles? I think about how I've described anterior and I relate. What is different? If I had a tibialis anterior, how different is tibialis posterior? For example, tibialis anterior was originating from tibia and interosseous membrane. Tibialis posterior, maybe not only. Tibialis posterior, on top of the two origins of the anterior, it also originates from the fibula. So tibialis posterior will originate from the fibula, the interosseous membrane, and the tibia. Where it inserts into the tuberosity of a bone called the navicula. Let me show you. It's covered. There's a bone called the navicula somewhere there. Let me see if there's a clear picture here. Okay, the navicula is somewhere there. Right. Okay. Then the flexor hallucis longus and the flexor digitorum longus. These ones I would describe with the ankle. The two of them have a unique mechanism in that they both start on the wrong side. By wrong side, I mean, can you see where the thumb is? Not the thumb, the big foot is. Then notice the hallucis is on the opposite side where the big thumb is not. Then the digitorum, which goes to the other four fingers, is on the side where the thumb is. So they should cross each other when we go to the foot. That's why I'm saying there's a mismatch when we're in the leg. This I'm mentioning because when we do foot, the same tendons that I've been talking about just now in the leg, I'm going to see them in the foot. And they will have relations where they pass through, which layer of the foot they are, because the foot has, the sole has 4 layers. We say first layer, second, third, fourth. These hallucis, they'll be in the second layer and they'll cross each other. Right? So we'll come to that when we do the foot. Right? Okay. Then do you guys have questions or things that you want me to add with regards to the leg? Not the foot, not anything else. The retinacular and the ankle would do them separately. Then the foot, we do it separately.
Okay, no, for me it's okay.
Okay. Christina? No question.
No, I don't have a question.
All right, that's fine. So, okay. So, you were doing upper limb, you're still doing upper limb. You've come across something called a tennis elbow, right? Am I right? Tennis elbow, which was rupture of the lateral epicondyle. Have you come across something like that?
Mm-hmm.
You have?
Yeah.
Then there was a golfer's elbow. Golfer's elbow is rupture of the medial epicondyle. So when you come to the lower limb, you guys are medical students, so I can use embryology terms. The lower limb, when the upper limb develops, it rotates 90 degrees lateral. Meaning when the upper limb, initially they're like this. They rotate, let me put it a bit forward. They're like this. They rotate 90 degrees lateral. They open. But the lower limbs, they rotate 90 degrees medial. Meaning what's lateral in the upper limb, in the lower limb you find it medial. What's medial in the upper limb, in the lower limb you find it lateral. That's why even in an anatomical position, you can see that the thumb is lateral, but the big toe is medial. Right. So there's going to be what we call a tennis leg. So if you just remember that tennis leg was affecting the lateral epicondyle in the upper limb. No, tennis elbow rather was affecting the lateral epicondyle in the upper limb. I think I've been talking too much. Tennis leg will affect something medial. Right? And usually we have a tear in the medial head of the gastrocnemius. Right? Then another clinical maybe which you may need to know is the Achilles tendon. That tendon for the gastrocnemius and the soleus, it's usually ruptured in tennis players. So if any of you follows tennis, you know that most tennis players, they get Achilles tendon injuries, right? Then I would also want you guys to know about compartment syndrome. Compartment syndrome can happen anywhere where there's a compartment, right? And if you read in Snell, I think it's talked about under upper limb and lower limb, but they really don't do justice about it. But there's something called compartment syndrome, right? Where there's a buildup of pressure in a compartment that goes beyond the hydrostatic pressure of the blood in the blood vessels. So they start to compress the blood vessels and they close. Then you start to get things like pain. They become pale since the blood is not going. actually characterized by 6 P's: pain, pallor, poikilothermia, and the likes. So just know there's a compartment syndrome which can affect a compartment because it is boundaries. A compartment is boundaries. So if you have build-up of pressure there is no way to distribute the pressure. So the only logical thing to do is to do a fasciotomy to cut the fascia and the pressure goes out. Right. Okay. Those are just clinical correlates that you can think about when you are talking about the leg. And of course, tendon grafting. We can use the plantaris for tendon grafting, just like how we use the palmaris longus from the upper limb. Right.